Hello, everyone, and thank you so much for the invitation to talk about bedside screens and visual decision support tools. So, before I start, let me disclose the fact that I had the opportunity to develop screens with many different companies over the last 25 years, that I'm today leading a consulting and research company based in Switzerland, and where we focus on digital innovations with medical applications. So I'm going to discuss at-a-glance monitoring. Then I will show you how we can turn data into information and knowledge using pretty basic, simple visual tools. Then I'll say a few words about abstract and metaphorical display before discussing what could be next. So at-a-glance monitoring is actually a concept described by Simon Ford and Marc Ansermino in this paper from 2010. They video recorded anesthetists during surgery. To real life, they actually look at monitoring screens very briefly, but also very often. It's actually not really a surprise if you have in mind this typical anesthesia setting where anesthesiologists have to look at many different screens and have to integrate a lot of information to make therapeutic decisions. So this observation is clearly a plea for the integration of all monitoring data into a single unified display. And this is the example of a single unified display. But I think we are not there yet. It's still too much information, too many numbers that anesthesiologists would have to integrate at the same time. And we know the human brain has actually great difficulties to integrate or to process more than 7 information at the same time. The good news is that our brain processes visuals much faster than text. And so with very simple visual tools or tricks, we can turn data into information. Let me share with you an example. Here is a typical hemodynamic monitoring screen with 6 major hemodynamic variables displayed in different colors. Here, what we did is actually simply grid out heart rate and SVRI to highlight abnormal variables. And then it becomes, I would say, obvious that this is a situation where the blood pressure is low, the mean arterial pressure is low. This hypertension is obviously related to a low blood flow in a fluid responder patient. So this is typically what we observe in patients with hypovolemic shock. So you see, just with a few visual tricks, we can turn data into information. When we display information about pressure and flow, we typically use gauges or dials. So that's why many years ago with Uli Pfeiffer from Munich, we proposed to use dials as well on bedside monitors. And so you may recognize now some of these tools, existing tools, if you use them. We can go one step further and turn data into knowledge. To do so, we need to organize hemodynamic variables or physiologic variables according to their physiologic relationship. So this is an example, again, not very new. This one was published 20 years ago with Azriel Perel. And what we proposed is actually for transpulmonary thermodilation measurements to display the end diastolic volume and the ejection fraction next to each other, because these are the 2 determinants of stroke volume. And then to display stroke volume and heart rate next to each other, because these are the 2 determinants of blood flow. And then to display blood flow and vascular tone next to each other, because these are the 2 determinants of mean arterial pressure. So with this kind of graphical representation, in case of hypertension or hemodynamic instability, it becomes very easy to understand what are the underlying mechanism and then to select the most appropriate therapy. So this is an updated version for people who are using pulse contour techniques. You know today that pulse contour techniques or pulse wave analysis techniques are actually widely used for continuous cardiac output monitoring in the ICU, but also a lot in the OR. And here you would have a typical hypotensive event explained by vasodilation. Here, the same typical hypotensive event, but this time explained by a low blood flow and related to bradycardia. Here we would have low blood flow, but related to low stroke volume in a fluid-responsive patient. So typically what we observe in hypovolemic patients. And here again, hypertension, low blood flow explained by low stroke volume in a fluid non-responder patient. So what we typically observe in patients with cardiac dysfunction. So these are the four main, I would say, phenotypes or profiles we can observe in patients with systemic hypertension. So you're probably aware that recently it has been proposed to use AI actually to automatically identify these phenotypes or endotypes. And indeed, technically speaking, it's possible to use a machine learning system and to describe or observe these different clusters that would correspond actually to the four phenotypes I just described to you or shared with you. But as a matter of fact, I think with VisualTools, we have also specific patterns or actually a visual signature that would enable us to profile or to describe hemodynamic profiles simply at a glance. So I think it's a way to highlight the potential value of VisualTools. And this is an existing commercially available cockpit screen, I would say, using this logic with, as you can see, the mean arterial pressure and the two determinants, blood flow and vascular tone, and then cardiac output with its two determinants, stroke volume and heart rate. A few words about abstract displays. So another way to integrate multiple data is to design or create a shape with various colors that will be immediately recognized by the human brain. If you have in mind aviation, where safety has always been a top priority, it's interesting to look at the evolution of cockpits. You see from multiple dials to actually a graphical display, images mainly. So this is a pretty old study. It was published 30 years ago. But in this study, the authors assessed the ability of anesthesiologists to detect acute physiologic changes using either numerical information or visual information. So you have the exact same seven physiologic variables, which are displayed either as numbers or as an histogram or as a polygon. And actually, in this study, they showed that anesthesiologists were able to detect acute physiologic changes with a better accuracy and also more quickly when using visual tools. Here's another example with the hemodynamic target developed and proposed by Fabrice Vallée from the University of Paris years ago. So you have here five selected variables. And when everything is going well, when these variables are within the normal range or the target range, I mean, that's the kind of display you observe with, all these variables in the center of the target in the bullseye. But in case of deviation from normal or from a baseline, I mean, you have this kind of visual that enables the immediate detection of abnormalities. So here's a commercial version of this screen developed by, or this concept developed by Fabrice Vallée. So far, I discussed mainly hemodynamic monitors because it's a topic, sorry, I'm very interested in, but similar tools have been developed for physiologic variables. And here you have the example of a polygon developed to integrate FiO2, tidal volume, respiratory rate, PEEP, and the I/E ratio. So once again, in case of deviation from normal settings, that will become immediately visible on the screen. So metaphorical display, show us organs, typically the cardiovascular system with or without the lungs. And this is another pretty old study where the authors tested the ability of clinicians to detect specific clinical situations or specific scenario. using measurements coming from the Swan-Ganz catheter, from the pulmonary artery catheter, and using the numbers exclusively or using visual information. So here you have a sketch representing the circulation from the superior vena cava to the peripheral circulation. And at the bottom, you see we can visualize a rise in pulmonary arterial pressure, a rise in wedge pressure, a decrease in cardiac index, or a rise in systemic vascular resistance. And of course, as you can imagine, this study showed that anesthesiologists and intensivists who were part of this study actually were able to detect this specific scenario with more accuracy when using the visual information. These are examples of the metaphorical screens that Uli Pfeiffer and I developed many years ago for transpulmonary thermodilation. The idea was to be able to visualize a decrease in cardiac preload, to visualize an increase in lung edema or systemic vasodilation or vasoconstriction, sorry, in that case. And here is a commercially available version of this concept. Even for fluid responsiveness, we don't have to simply display a PPV or SVV value. We can clearly show the position of the heart on the Frank-Starling relationship. There are actually today many examples of metaphorical screens I could share with you or describe. Most of them have been developed for hemodynamic monitoring. But some, this one, for example, you would find it on a mechanical ventilator, and it would enable the visualization of any change in respiratory resistance or any change in lung compliance. I think the most recent example of metaphorical screen is probably this avatar developed by David Scholl from the University of Zurich. You can use it to display basically everything you want. You just have to select the variables you are interested in. You can even display actually the tools you are using to monitor or to treat your patient. And so at the end, you have to be careful because if you tick all the boxes, it may become a little bit busy. There are also a few visuals, like this brown shadow around the body representing hypertension, or this blood level in the heart, which actually has nothing to do with volume status, but is a marker of ST segment elevation. So some of these visuals are maybe not as self-explanatory as they should, or as intuitive as they should. But I think the concept, again, is interesting. And with a few tweaks, that might become a very interesting tool to share visual information to clinicians. What could be next? So there is basically no limits to the imagination of graphical designers. By the way, it's for me the opportunity to say that, when you develop these kind of screens, you have to work. It's better to work with graphical designers and not only with clinicians or engineers. And here is the example of, I think, a very creative proposal where every red egg or red ball would represent a heartbeat. The color, the red color, depends on oxygen saturation. So here, for example, these dark red would mean a decrease in SpO2, hypoxemia. The level of the ball depends on the blood pressure. So here I show you some an hypotensive event. And the blue and green curtain in the background is actually the information about respiratory physiology. So you can visualize the respiratory cycles. You can visualize the tidal volume, the FiO2, the end-tidal CO2, and so on and so forth. So there's a lot we can do with creativity. New tools to display the information. Of course, we can display, of course, the information on classical screens, but also on smartphones and tablets. I'm not sure it's extremely useful, but at least it's technically doable. Same for the smart glasses. I'm sure at some point it will be possible. Once again, I'm not convinced by the clinical usefulness, but we will see when these tools will become available. I personally believe there are two things which are really important. The first one is data integration. And I already mentioned that briefly at the beginning of my lecture. data integration into a single monitor. So many of the variables displayed on these various monitors actually could be displayed on the main monitor. Thanks to connectivity protocol, thanks to smart cables. Also, it's important to realize that, for example, to monitor cardiac output with a pulse control algorithm, the pulse control algorithm itself is simply a software. So it could be integrated into a regular bedside monitor. And hopefully, that's something we will have at the bedside in the near future. And the second point I think it might be very important for the future is what we call data fusion. It's when you merge several variables into a single new variable or visual tool. So here is just an example to describe the concept. We merge heart rate, mean arterial pressure, cardiac output, X, Y, Z together. And some may be normal or other variables may be abnormal. And then we end up with a single variable giving an overall view of the physiologic status of our patient. So in this example, that would be this small white star navigating between the green and the red zone, depending on the clinical situation. Here would be a wellness index or deterioration index, you name it as you wish, depending if you're an optimistic or a pessimistic person. But I think it's self-explanatory, right? It's 100% visual. You don't even see a number, and you don't need a number to understand that the patient at the top is pretty stable, deteriorating a little bit at some point, but recovering very quickly. In contrast, the patient at the bottom is pretty unstable and clearly deteriorating at the end. So you see, we can do a lot with visual tools. So in conclusion, you saw the evolution of bedside screens has been pretty significant over the last 20 years with more and more visual decision support tools available on hemodynamic monitors, bedside monitors, mechanical ventilators. These tools are useful to turn data into information and into knowledge. They enable more accurate and faster detection of abnormalities. There are many studies which have confirmed that. A better understanding of measurements and of the clinical situation, and we often refer to situation awareness when we discuss this topic. And the icing on the cake is that these visual tools are usually useful to also decrease cognitive workload. So it's good to know. So if you're interested in the topic, with Adrian Wong and Vanina Edul, we just published this paper on visualization of hemodynamic information in critical care. And with that, I thank you very much for your attention. Thank you.